Unfortunately, last night, one of my favorite players, Jayden Daniels, suffered a devastating elbow injury to his left elbow. It was a grotesque dislocation. Is going to need surgery. Definitely will be a season-ending injury, hopefully not a career-ending injury. It's now Tyreek Hill, Cam Skattebo, and Jayden Daniels all suffering devastating injuries. That's the nature of football. It's a high-energy sport with significant risk of injury. In this case, what appears to be probably a posterior lateral dislocation of the elbow with possible fractures. We don't know at this point. And it highlights the importance of what we do as orthopedic surgeons to save the limb, the life, and hopefully the career of Jayden Daniels. He's definitely going to need surgery, extensive rehab, more than likely ligament reconstruction, several months to be able to return to play. Thankfully, it was his non-throwing shoulder, and we all send thoughts and prayers to him and his family. Very difficult injury to recover from. I do believe he will recover. He will, I think, be as good as ever. Yeah, posterior lateral dislocations of the elbow. A traumatic elbow dislocation occurs when the bones of the forearm, the radius, and the ulna are forcefully separated from the upper arm or the humerus. This is most commonly due to a fall on an outstretched hand during sporting events, such as what you saw with Jayden Daniels. This injury is considered an emergency. It can involve damage to blood vessels and nerves, bones, and needs immediate medical attention for reduction of the elbow, popping it back in place to prevent long-term complications. So some of the key facts regarding elbow dislocations is they can be simple with no fractures and just ligament injuries, or complex with fractured bones, torn ligaments, artery and nerve injuries. Posterolateral dislocations with the forearm bones moving backwards and outwards are the most common type. More than likely that's what Jayden Daniels suffered from. Immediate symptoms, of course, include pain, deformity, swelling, inability to move the elbow, numbness in the hand. Treatment involves proper reduction, putting the elbow back in place, usually done in the emergency room or the operating room, followed by possible surgery or just immobilization. Afterwards, whether it be surgery or just a period of immobilization, early motion and physical therapy thereafter are critical to regain the mobility and reduce stiffness, which is the most common long-term problem. Although these injuries are rare, they can cause arthritis and long-term stiffness and weakness and instability of the elbow. Hopefully, with the excellent surgeons for the Washington Commanders, they can get Jayden Daniels back to a quick recovery. And thoughts and prayers out to Jayden Daniels. Here's to a speedy recovery. Look forward to seeing you play again. I'm one of your biggest fans. Dr. Keith, the Bone Doc, out.